So this gives me great pleasure to be here for our next presentation. For those of you who are relatively new to CFA, Brigid Rivoire was a former executive director of the organization, and she had a tremendous passion for farmer mental health and mental health in general. And a number of years ago, after we unfortunately lost Brigid to cancer, we felt at CFA it was appropriate to make an award in her name to really talk about organizations across this country who are doing great work in the mental health field. And I think we all know that it's an important topic that we didn't talk about. And so having this award after Brigid was very fitting. It is my pleasure to be able to introduce this year's Brigid Rivoire Award for Champions of Agriculture Mental Health. It's, as I mentioned, it's an annual award that goes to those that are doing great work in the field of agriculture and mental health. So this year I'm very pleased and happy to announce that the Guardian Network, which is an initiative in the province of Ontario that was created through a partnership with the Canadian Mental Health Association and the Ontario Ministry of Agriculture, Food and Rural Affairs, which trains volunteer suicide prevention network of guardians who regularly interact with farmers in the farm community. So I'd like to invite Marnie Wood and Bethany Parkinson to come to the stage, if they would, to present their program.
Thank you so much. Thank you. Do you want to run the button? Sure. Okay, got it. Good afternoon, and thank you very much for that warm welcome. My name is Marnie Wood. I am the Program Manager for the Guardian Network. I work at CMHA Ontario, and I'm also Ontario Dairy Farmer.
Hi everyone, I'm Bethany Parkinson, and I'm the Psychological Support Coordinator and Trainer for the Guardian Network, and I'm an Ontario sheep and beef farmer.
We are incredibly honored to be here today and to share with you what the Guardian Network is and the program's positive impact it has made within the agriculture community. Before we begin today, I would like to share a disclaimer. What we are sharing with you today in today's presentation discusses topics including mental health and suicide prevention. At CMHA Ontario, we highly value autonomy, respect, and sensitivity. If at any point, please feel free to leave the room and do what you need to do to take care of your own mental health. The Farmer Wellness Initiative, which we will talk about in just a moment, is available for support or additional resources. And that number, get your pens out, is 1-866-267-6255. The Guardian Network is part of Agriculture Wellness Ontario, a program within the Canadian Mental Health Association's Ontario Division. AgWo works to provide mental health support, education, community for Ontario farmers. Agriculture Wellness Ontario is a suite of 3 free programs that focus on mental health, well-being, support, and education. These programs include the Guardian Network, the Farmer Wellness Initiative, which we'll be discussing, as I said, and In the Know, a mental health workshop that focuses on topics such as anxiety, depression, substance use, PTSD, and how to start the conversation surrounding mental health. Ag Wellness Ontario is paid for in part by the Government of Canada and Province of Ontario with the support of OMAFRA, as well as the Canadian Agricultural Partnership. We would like to thank the Honourable Minister Lisa Thompson, as well as the Honourable Minister Marie-Claude Bibeau for your support for Agriculture Wellness Ontario programs, your representation, and knowledge within ag communities.
In 2016, a national survey of farmer mental health was completed by Dr. Andrea Jones-Bitton and Dr. Brianna Hagan. And the research indicated that 35% of farmers met the classifications for depression, 58% of farmers met the classifications for anxiety, 45% of farmers reported high stress, and 68% of farmers were more susceptible than the general population to chronic stress, which can lead to physical and mental illness. And not listed here, 40% of producers across Canada report that they would feel uneasy about seeking professional help due to what people may think. It's important to note that this study was completed prior to the pandemic, and more recent studies of general populations have shown that the pandemic has had an even greater impact on mental health. The research reflects the importance of these programs within Agriculture Wellness Ontario. A 2021 report from the Mental Health Commission of Canada showed that rates of suicide are higher in rural settings than urban areas. According to the report, rural communities face unique challenges across the social determinants of health, which include higher levels of income inequality, lack of consistent and local employment, a seasonal and rotational way of life, increased levels of food insecurity, more limited access to clean water, and less access to high-speed internet. What is probably the most alarming information to come out of this study is the statistics surrounding suicide. In this study, farmers experienced suicide ideation 2 times more than the general population, and 1 in 4 Canadian farmers in the study felt their life was not worth living, wished they were dead, or thought of taking their life in the past 12 months. Compared to the study conducted in 2016, stress and burnout levels were reported to be much higher by farmers, with 76% classified as experiencing moderate or high perceived stress. The previous studies so much resonate with the need for programs such as the Guardian Network. The Guardian Network was created by AQPS and adapted to meet the needs of the Ontario agricultural context. The Guardian Network is a volunteer suicide prevention network that includes both the training and program to support the agricultural community. The Guardian Network training is a free 7-hour workshop that can be facilitated virtually or in person and allows guardians to build skills and understanding to identify the signs of mental distress, start a conversation with a farmer who may be at risk of suicide, and connect individuals with mental health and crisis resources. As Marnie noted, all programs within the Agricultural Wellness Ontario are free. Following the training, guardians also have access to the Guardian Network program. So who are guardians? So guardians are individuals who are 18 plus, and they're eligible to be guardians as they may be in contact with farmers, as well as their place in the community, work, or volunteer activities. Trained guardians will have completed the training workshop and are able to use tools and strategies to identify the signs of mental distress and, through conversation, connect farmers to appropriate resources to support their mental health. So the Guardian Network launched in June 2022, and since then, as of February 2023, so a few short weeks ago, there have been 102 trained guardians. And as I said, the Guardian Network launched in 2022, in June, and 12 training sessions have taken place, 8 virtual and 4 in person, and hosted across all of Ontario. So the graph here indicates just where the trainings and the guardians reside. And this graph outlines a more distinct overview of the geographical demographics of guardians and where they are located within Ontario. The Agriculture Wellness Ontario and CMHA Ontario team aims to reach all areas of Ontario and a variety of agriculture communities and organizations when promoting our programs. We have 2 open virtual trainings upcoming on March 31st as well as April 21st. More information and how to register is available on the Agriculture Wellness Ontario website under the Guardian Network. To add to the demographics of trained guardians, there are a few details of the Guardian Network training that I would like to share. The training is a 7-hour workshop that includes skill building on starting mental health and suicide prevention conversations, what risk of suicide looks like specifically in an agricultural context, as well as building a background and framework on what suicide prevention is and things we can all do as individuals to decrease stigma. The scenarios discussed in the training are farmer and agriculturally based and aid in group discussion while meeting the needs of the farming community. In addition, guardians are equipped with the skills on how to respond to individuals who may be at risk of suicide and how to connect them with the appropriate mental health resources and crisis support. The Guardian Network program portion was launched in January 2023, and Guardians meet for 1 hour each month on Zoom to have a personal check-in, agriculture or work check-in, as well as to ask any Guardian-related questions. In addition, the time is dedicated to building new skills as well as information sharing. The Guardians also have access to attend the National Symposium on Agricultural Mental Health and the Guardian Network specific date on March 8th and March 9th. During this conference, Guardians will hear from experts across the country on mental health to support agricultural communities, research, and participate in concurrent sessions and workshops.
One of the key aspects of the Guardian Network is access to support through the Farmer Wellness Initiative. Guardians are able to call this line for debriefing support before or after having a mental health-related conversation with a farmer. They are also eligible to access their own counseling through the line. The line is accessible 24 hours a day, 7 days a week, 365 days a year, in English and in French for farmers and their families. Once going through the intake process, a counselor will be in contact with the farmer or guardian to schedule a counseling appointment. If the individual is in crisis, they will speak to a counselor right away. The line is not anonymous, but is confidential. We would like to give a tremendous thank you to a number of individuals. We are so appreciative of the Brigid Rivoire nomination and award. This will significantly help promote the Guardian Network and aim to increase mental health support and mental well-being and reducing the stigma surrounding mental health in the agricultural community. We would like to thank the Quebec Association for Suicide Prevention for their groundbreaking initiative, continuous support, and work with our program. Congratulations to our fellow nominees, and please continue doing the great work that you do. Thank you so much to the Honourable Minister Thompson and OMAFRA and the Honourable Minister Bibeau and Agriculture and Agri-Food Canada for their incredible support of the Guardian Network, as well as Agriculture Wellness Ontario support for our programs. Thank you very much to the Canadian Federation of Agriculture for hosting the Guardian Network team and including us in the AGM and providing space to discuss resilience and growth in agriculture. Thank you lastly to the AgWo team, Kristen Wheatcroft, Lindsay Hastings, Danica Davies, Adriana Van Oostveen, and Kevin McGregor. If you or someone you know or a group of individuals would like to access Agriculture Wellness Ontario programming, please go to our website, agriculturewellnessontario.ca. Thank you very much for this tremendous honor.
Down there, Lindsay, or here?
Oh, just around from the, sure.
It amazes me every year how we continue to grow our mental wellness programs right across the country, and this is certainly another fine example of one. For those of us who come from Ontario and certainly have been engaged in mental health issues over the years, this next guest is certainly no stranger. Someone who, gosh, I think it's probably been 10 years maybe that she's been involved in this, but very, very pleased to have Dr. Brianna Hagan here today. She's going to talk about a new initiative, the Canadian Centre for Agricultural Wellbeing. So, Brianna.
Hello. Can everybody hear me? I'm a little shorter. Thank you. I am so grateful to be here today, and I want to extend my sincere congratulations to the Guardian Network for all of their incredible work and their Brigid Rivoire acknowledgement of that hard work. Congratulations. I also want to thank CFA for inviting me here to talk about CCAW and the exciting work that we are doing. I hope we know that over the last several years, farmer mental health has been garnering a lot of attention from the community, from the federal government, provincial government, and other ag supporters. Early epi data back from 2016 that was previously discussed continues to show that farmer mental health is struggling. We know ag is an integral part of the Canadian economy and it plays a crucial role in feeding the world's population. However, farming can also be extremely challenging and stressful, and farmers face numerous physical, mental, and financial challenges. When data showed that farmers were experiencing depression, anxiety, burnout, and suicidality at increased prevalences compared to other occupations in Canada and the general population, the ag community stepped up to begin to tackle these grave issues. Research and programming for farmer mental health has contributed to tackling issues of stigma and increased mental health literacy among farmers and people who work with farmers. In 2019, all of the provinces and territories gathered and identified mental health as a priority to ensure the sustainability of Canadian agriculture. An identified gap in that meeting was the lack of national infrastructure to create, evaluate, and disseminate evidence-based, farm-tailored mental health programming and services. This is where the Canadian Centre for Agricultural Wellbeing comes in. Established just a few months ago, back in the fall of 2022, CCAW is a new national not-for-profit organization that will promote the well-being of Canadian farmers by using a grassroots research-to-action approach to farmer mental health in Canada. CCAW was built on 4 pillars: research, advancing mental health research and program development with our national and provincial partners; capacity building, building sector capacity and growth through our research and programming; partnership, solidifying our national network and with new and existing partnerships; and empowerment, supporting and empowering farmers to take care of their well-being. The board at CCAW and the staff at CCAW are made up of farmers from different regions across Canada with very different skill sets that contribute amazingly to the center's overall vision. I want to mention our Chief Programming Officer, Deb Van Berkel, who's a previous Brigid Rivoire Award winner, who has been contributing to the development of farm-specific psychological supports for many, many years. One member on our board is Professor Jones-Bitten at the University of Guelph, who has been contributing research and program development for years, and our Chief Operations Officer, Marnie Wood, who is here today as well. CCAW has already hit the ground running in the few short months that we have been established, and we have several initiatives that I hope we can all get excited about, including the vast expansion of In the Know. We are taking In the Know to every province and territory. We have it in 3 languages, French, English, and Spanish, and it is going into post-secondary institutions. We're working in partnership with many organizations provincially and CMHA, along with the federal government, to ensure that everyone has access to farm-tailored mental health literacy training. The second initiative is the development of a mental health toolkit for catastrophic events. As our climate continues to change, our industry needs to be able to support farmer mental health in the event of an on-farm crisis, whether that be a weather-related emergency or an emerging disease. Next, the development of a national farmer mental health support line. This will be supported by mental health professionals who've been trained in agricultural literacy using an evidence-based programming approach. We are currently in the final stages of development of this national support in partnership with TELUS Health. And lastly, the one thing I want to mention is our first national symposium in agricultural mental health that is happening virtually tomorrow. So if you haven't registered for that event, I would encourage you to go to ccaw.ca to have a look at the agenda and join us. We have folks presenting from coast to coast about things that have worked for them, developing mental health programs over the last 25 years, and a vision for how we can move forward with our national network. So I want to leave it there. I would encourage you all to visit our website or reach out to me. And I just want to thank CFA again for all of their support in allowing me to announce our center here today. Thank you very much.